Michael J. Fox, best known for his role as Marty McFly in the Back to the Future series, was diagnosed at age 30 with early onset Parkinson's disease. He first noticed twitching of his left little finger while shooting the movie Doc Hollywood, and at the time thought it was a result of too much partying. After the diagnosis was confirmed, he hid his diagnosis from the public for approximately 7 years. Parkinson's disease is a progressive disorder of the central nervous system. It is the second most common neurodegenerative disorder with an onset of 50 to 60 years of age and most often affects men. As many as 1 million Americans live with Parkinson's disease, which is more than the combined number of people diagnosed with multiple sclerosis, muscular dystrophy, and Lou Gehrig's disease. Parkinson's disease was first described as the shaking palsy in 1817 by James Parkinson. He observed 5 of his patients and 1 person in the community as having similar symptoms. Parkinson's disease is now classified as having 4 cardinal features, which include tremor, bradykinesia, rigidity, and postural instability. Researchers are unsure of what exactly causes Parkinson's disease, but a combination of genetics and the environment appear to be possible causes. It is caused by degeneration of the substantia nigra in the basal ganglia that produces dopamine. Dopamine is a neurotransmitter that allows for coordination of movement. Clinical signs emerge when 30 to 60% of the neurons have degenerated. By the time the cardinal signs appear, 80% of the neurons are lost. Tremor is a cardinal sign that results in involuntary shaking of a part or parts of the body. It usually begins in the hand or foot on one side of the body and progresses in intensity and to both sides of the body. Michael J. Fox reported that the tremor began on his left side of his body, and initially he could subdue his tremor by pacing because the tremor is a resting tremor and disappears with movement. A resting tremor is present 70% of the time in the early stages. Bradykinesia is another cardinal sign that literally means slow movement. This is commonly exhibited as freezing episodes, which are triggered by competing stimuli, such as when a person begins walking from an open room to a narrow hallway. Bradykinesia can cause hypomimia, which it refers to a reduced degree of facial expression, resulting in a mask-like face. It can also lead to micrographia, where the handwriting becomes smaller as the person continues to write. Bradykinesia affects the person's gait, causing a reduction in arm swing and step length. Rigidity is the third cardinal sign and is observed as stiffness in the body. There are 2 different types of rigidity that are possible with Parkinson's disease. Lead pipe rigidity is a uniform resistance to passive movement, regardless of speed. Cogwheel rigidity occurs when a tremor coexists with rigidity and results in jerky, ratchet-like resistance to passive movement as the muscles alternately tense and relax. Stiffness of the limbs is characteristic, and Mr. Fox reported his stiffness even caused him to have difficulty changing the channel using his remote control. The final cardinal sign is postural instability and is rare within first 5 years of the diagnosis. It causes weakness of the anti-gravity muscles that leads to a flexed and stooped posture. The postural instability directly affects balance and causes an injury rate from falling of 40%. Within 10 years of the diagnosis, approximately 25% of patients will develop a hip fracture from a fall. There is no cure for Parkinson's disease, and Michael J. Fox retired from regular acting in 2000. Within that year, he launched the Michael J. Fox Foundation for Parkinson's Research, which is the largest nonprofit funder of Parkinson's drug development around the world. In 2012, Fox announced his intention to return to full-time acting and has since acted in The Michael J. Fox Show, portraying a beloved newscaster and family man who returns to work following a diagnosis of Parkinson's disease.